Hi everyone, here's Nancy, the nurse practitioner, with more information for you. I know you just saw a video about how to position someone in bed, and I left out one part that I'd like to make sure you know about, is that when you position somebody, make sure you put a pillow in front of them, of course like lower, so they can hold on to it like a body pillow, kind of like hugging it, so that they have something to support them. So that was one pillow that I think you should have, and that would help the person feel much more comfortable. So as part of positioning in bed, which is most of the most key things you have to know when you have somebody who needs total care, it is necessary in order to prevent something called pressure sores. Pressure sores or bed sores are extremely common in the elderly. They're expensive to treat. They take forever to get rid of, but they're very preventable. So let's go through some stuff that will help you learn how to prevent a bed sore, how to take care of somebody when they get a little one so it doesn't get bigger, and having the crystal ball to prevent them altogether. So actually, what is a bed sore or a pressure ulcer, you may have heard? It's actually an injury. It's actually something that's caused by unrelieved pressure from being on a spot too long on the body, and it causes damage to the skin and to the underlying tissues. So if you think about this, you know, when you look at blood vessels, they're tiny little blood vessels on your skin surfaces, like little straws, and they carry oxygen and nutrients to your tissues. And if you lay on that spot and crush that straw or bend it for too long, the nutrients and oxygen do not get through it, and they do not reach the tissue, and the tissue dies. So not that I want to scare you or gross you out, but I do have some important pictures to show you about what bed sores look like. And just the other day, one of my patients just sent me a picture of something on someone's ankle, and she didn't know what it was. And it's actually the beginning of a bed sore. So what I'm showing you here is her right inner heel. It is a blister, as you can see, a big, clear filled blister. And there's like a little area here where she actually had some pressure. The person is mentally disabled, very skinny, does not move a muscle, and one leg was on top of the other, and I think it just got missed. The mother noticed it. She was totally upset, and I told her we can help her get rid of it. So right now, that's the beginning of the bed sore. Usually what happens is that the blister pops, which it's gonna do, and all this clear or serous drainage comes out. So I told her to put a maxi pad on it or some kind of thickened dressing to absorb it for the first pop, because there'll be a lot, and then change it every few hours till it stops draining. And I also started an antibiotic because I figured this may get worse really fast. We also did some blood work on her just to see how she's doing. Is she nutritionally okay? Is she dehydrated? Does she have an elevated white count that might mean an infection setting in? What's her protein level? So those are some things we're going to go over, but they help you kind of see where you're heading if you don't treat it right away. Here's another picture of a bed sore. Now this is actually what the heel will look like in time. Once that blister pops and the skin dries out, you will get that sort of brownish, necrotic kind of looking skin. Until that brownish stuff comes off, we're not sure how deep that wound is. Now, bed sores can be superficial, or they can go all the way, crater through the tissues, muscles, and to the bone. And I've seen some pretty bad bed sores in my time. It's really important to catch them before they get really bad. So this is where she's going to be heading probably in the next week or two. And here's another spot of a lower person's back, a woman's back. You can see that it's all bony along here, little spots, and any of those spots that are red could break down. Maybe she's sitting in the wheelchair too long, maybe she's lying on her back too much, but she's not knowing to move, and so this little tiny bed sore happens. So once the skin broke, this is actually called a stage 2 bed sore, which we'll be treating. These other two are much deeper and worse, but I want to show you the extent of how bed sores can get, just so you know how the reality is and how to actually think about how I'm going to prevent this from happening to my mom or dad or friend. This is one of my patients as well. This was a few weeks ago. Sometimes I start seeing lots of skin breakdowns for no apparent reason. It seems as the person is deteriorating, doing poorly, and approaching the end of their life. This particular man did actually pass away recently, but this is from like a month ago. And as you can see, there's some pinkish tissue here, and then there's like this yellowy wet base here, and that will all have to be sloughed or what's called debrided off to get to the clean wound part to help it heal. And the last one I want to show you, and actually you can see it's on his near his diaper line here, so it was on his bottom. This is his bottom. The last one is somebody else. You can see this is also on the butt. It's on the inside, crease here. And this one you can actually put a Q-tip in, pretty far in. So that means it's actually cratered in, and we don't know how deep that goes right now. So as I'm showing you that, I don't want to scare you away because it's a reality, but I do want you to know that we can help you prevent these, and that's a good thing. So basically, this is what happens. You have the mattress here on your bed, and the skin is right here. And as the person's lying over and over on the same spot, the bone that's sitting on the top actually gets pushed down, and the blood vessels get squished, and this skin right here starts to die, and all of a sudden you're finding out that there's a bed sore that's starting right here, and it lands up tunneling or getting deeper. Very important for you to have a visual of all the spots where you can actually get a bed sore. Oops, sorry, I moved us. Is the back of the head, the scapula, which is the wings in the back, along the spine that you saw, the coccyx, which is the lower back, any hips, elbows are big, the heels, and then make sure you look at the wheelchair. The back up towards the top, right on the butt or the lower part, and right on the bottom of the feet. And if the person's lying on their side, look at all the spots that they can get bed sores. The side of the heels, the calf, the upper thigh, the buttock in two places, and even the ear. So there's some lots of spots. So just imagine any place where you don't move, and you stay there for a long period of time, you have a chance of getting a bed sore there. So we talked about how it happens and the blood vessels get squeezed. The other thing that can cause bed sores is something called shearing. It's when the person slides down in bed or gets moved by just being pulled down in bed or on a wheelchair, and it lands up causing the friction, and the skin and the blood vessels get pulled and can be stretched and bent, and it causes bed sores to develop. You actually see like a tear, like a layer of tearing going on the top of the skin. So let's talk about who's at risk for bed sores. You and I aren't. If we're walking, we have perception for pain, we're continent, and we eat well. So you can think about the person who is at risk. A person who is bedridden, a person who is chair confined, where you have to move them from place to place because they don't walk. So that's the first person to think about. The second one is somebody, when you think about the person, you got to think about a person like in a coma. Think about them. They're bedridden, they don't move. You have to move them. Somebody who has paralysis on one side from a stroke, they won't feel it on that one side, and I've seen bed sores on that heel, and they just never knew they had it because they didn't feel it. You're talking also about somebody who had a hip fracture, and they also don't move that leg, and they're also at risk for getting a bed sore on that heel or somewhere along the leg. Other people who are at risk are those who are with no control of their bladder or bowel. That would be people who are in diapers and they don't know they're getting wet, and they don't know to tell you that they're wet, and they're sitting maybe for a few hours, maybe more than 2, more than 3, over and over again between changing, and they're at constant risk of breaking down or having skin irritation. Or somebody who perspires a lot. under the breast folds, on the armpits, into the abdominal folds, in the groin. They're just sweaters, and they tend to make moisture, and moisture makes the skin irritated, and with moisture and darkness, skin can break down. The other important thing is poor nutrition. If you have mom and she says, I just don't want to eat today, it's a really tough call, because if she's not eating meat and vegetables and fruit and drinking liquids and and just having tea and maybe some crackers and not much of anything, that's not a healthy diet, and she's at risk for getting bed sores. And also mental status. If someone has dementia or they lack perception, they're very increased risk due to mental changes for getting bed sores. So let's talk about the solutions, and let's spend a lot of time on that. So you know who's at risk, so you know right away if your mom or dad are one of those people at risk. If they have 1, 2, 3, or 4 of those problems, the more they have, the higher their risk is for a bed sore at any given time in their lifetime. First thing we'll go over is how to take care of the skin. Skin is our biggest organ. It's the most important one for preventing bed sores, to keep it clean and to keep it dry. And so what I tell people is when you're getting a bed bath every day, or they're in a shower, give them a good inspection. Go washing behind the ears, look at the back, look at the elbows, look at the knees, look at everywhere so you're not surprised. Actually, look at the bottom of their feet. A lot of people don't look at the bottom of the feet. And pick up an arm and look at an elbow. I mean, those are things that will really help you say, wow, I just wouldn't have known if I didn't look. So it's important to take a look all over and do a daily inspection. And if you see something red that doesn't change and it stays red and it doesn't blanch when you touch it, where it doesn't change color, it could already be something called a deep tissue injury, and you do not want to rub that. The skin has already been damaged and it's just ready to break down. So do not rub a red area that's on a hip or one of these bony spots I showed you if it looks like it doesn't change color when you touch it. Okay, so you're a successful caregiver by doing this. This is Nancy, the nurse practitioner. See you at the next video.